Hi, I'm Daniele Noviello, second-year resident in gastroenterology at the University of Milan. I'm going to briefly present to you the key results of our work entitled Functional Gastrointestinal and Somatoform Symptoms 5 months after SARS-CoV-2 infection, a controlled cohort study. It is well known that bacterial, protozoal, and viral infections of the gastrointestinal tract represent a risk factor for the development of functional gastrointestinal disorders such as irritable bowel syndrome and functional dyspepsia, as well as chronic fatigue and other extraintestinal somatoform symptoms. In February 2020, a SARS-CoV-2 outbreak occurred in Italy with extreme severity in Milan and the surrounding Lombardy region. The aim of our study was to assess the frequency and relative risk of gastrointestinal and somatoform symptoms 5 months after SARS-CoV-2 infection compared with the control cohort through an online structured questionnaire. 164 SARS-CoV-2 positive patients and 183 controls were included. Gastrointestinal symptoms were assessed through the Structured Assessment of Gastrointestinal Symptoms, shortly SAGIS questionnaire. Our results show that gastrointestinal symptoms do persist after SARS-CoV-2 infection, but with very low severity. In fact, the relative increase on the mean score of each SAGIS domain was minimal, and the absolute score failed to achieve even the level of 1, which identifies, according to the SAGIS classification, the severity of a symptom, mild, that can be ignored when you don't think about it. In comparison with the control group, patients with a previous SARS-CoV-2 infection had an increased risk of loose stools, chronic fatigue, and somatization. Symptomatic sequelae were more severe in subgroup of patients with diarrhea during the acute infection. In conclusion, mild gastrointestinal symptoms persist 5 months after SARS-CoV-2 infection, together with an increased risk of chronic fatigue and somatization. These results support the hypothesis that both functional gastrointestinal and somatoform disorders may have a common biological origin.